Thank you for visiting the Reader Vein Institute website. I'm Dr. Steve Reader, and today we're going to do a procedure on this young lady who has reflux, that's backward flow in her great saphenous vein, and this has caused her to have some varicose veins along the upper part of her lower leg. Her symptoms have been the usual ones of this problem, which are aching and heaviness of her leg with some swelling. And today she'll have a radiofrequency closure of the great saphenous vein, microphlebectomy or removal of the varices. And that should complete the treatment today. All of this will take probably 45 minutes or so. And we hope it'll be nice and painless for her and pleasant for us. So this is our patient, Ann. Thank you for coming and cooperating, Ann. If you would stand up for a minute, I'd like to show a little bit about what the problem with your leg is. I'll just do briefly an ultrasound showing the great saphenous vein in her thigh. Normally we just compress the calf below and then release. And in a normal vein, you should see only a split second of red coloration, but you can see this is pretty much red for several seconds continuously after compression. It's at this point that the branch comes off of the great saphenous vein and it leads to these varicosities and extending along the back of her calf as well. Prior to the procedure, we always mark these with an ink so that we'll know exactly where they are when we remove them. I briefly marked the areas of the varicosities on her leg with her in the standing position. When she lies down, sometimes the veins move a little bit, so that in order to be real accurate where they are, I'll do them when she's lying down. I'll mark them using this light that actually sees underneath the skin. Now we've got the veins marked and she's prepped and draped. As you can see, she's wide awake because she is driving home today. And now I'll look with the ultrasound and find that great saphenous vein again to pick the best spot to access it. So now we have the little catheter placed into the saphenous vein. And now I take the radiofrequency catheter and slip it into this sheath, and we'll pass this to the groin where the great saphenous vein meets the femoral vein. Now the catheter has been placed in the great saphenous vein, and you can see the white spot on the screen, and it casts a shadow down. That's the tip of that is the catheter. And then when it disappears, that's the tip right there. And on the left, the dark circle is the femoral vein. We know that we're about 1.5 inches or so away from the deep vein. And usually this part is pretty painless. Have you felt anything at all?
Nothing. I'm surprised that you're that far with it already.
Oh, good. Good.
Good for me.
Good for you. All right. Now that the catheter is in the right position, I'm going to place some anesthetic solution. We call it tumescent anesthesia. That white dot is the catheter, and now you see the vein is collapsed around it, and this big black halo around it is the anesthetic solution.
Oh.
And as I do this, I can see my needle and place it so I know exactly where to put it in order to get it both above, below, and around your vein. Mm-hmm. Personally, at this time, at least, prefer the radiofrequency to the laser because the heat is not so intense, and the post-procedure recovery is much easier, I've found, and less bruising than the laser. So I pretty much have exclusively used the radiofrequency now instead of the laser. And I'm going to compress this as we start it, okay? The heating element of the catheter is 7 centimeters in length, so we have a time of 20 seconds for every 7 centimeters. And once again, he'll pull the catheter out 7 centimeters. Good. And I'll compress it again with my ultrasound probe. Uh-huh. So now we've placed the anesthetic solution, the tumescent, underneath the veins that we marked before the procedure began. So we'll know exactly where they are, because now they're so collapsed that they're just a fraction of the size they were when she was standing. So what we've done so far is we've closed the great saphenous vein with the radiofrequency down to the point at which it gave off tributaries, and those tributaries led to the bulging veins just underneath the skin. So now we're removing those tributaries and varicose veins so that in a couple of weeks from now her legs should look back to normal, and it should relieve her symptoms today. So now that we're all completed, and she's got about a dozen of these tiny little wounds, and each one of them we're just going to cover with a Steri-Strip. And that's the last Steri-Strip, and we're done.
I had a varicose vein when I was in 7th grade, but it was very small. And then as time went on, you know, it got bigger, and then I started getting more pretty much in the same area. And then they just started becoming uncomfortable. A lot of tightness and a little bit of pain, a lot of aching and stuff like that. So I just decided it was time to have this procedure done on my veins. So I saw Dr. Reeder, and he recommended a procedure to me. And I felt very comfortable with him and the procedure that he recommended to have done. I didn't know a whole lot about it, but just with what he had told me, I just felt really comfortable with his knowledge in the procedure and everything. So I decided to have that done, and I just had it done probably 15 minutes ago, and I feel great. And I'm ready to drive myself home, but I am going to come back to see him again in about a month. I do have to have another procedure on my other leg, which is going to be a little bit different, kind of in the same area, but a little bit different than this one that I just had. And I'm definitely coming back to see him again. He did a great job, and he just makes you feel very comfortable while you're having the procedure, and I definitely recommend him.